Okay, so there's two ways we consent a patient. The first one is if they're already a returning patient and they're getting the same treatment done that they've gotten done in the past. In the check-in process, when they're given the COVID-19 consent form, the front will actually pull out the consent of the procedure they're getting done today, and then we'll go ahead and have them fill the consent. Now, if they're a new patient or they have questions about the procedure or never done it before, we usually have them consult with Dr. Kormeili first. We'll price quote them, and then we are the ones to give them the consent. So there is, we do have these bins in every single room. In the front, you're always gonna find some clipboards for the consents. And then right here, we have everything we need consent-wise. The two front ones are the most important ones that we use on a daily basis, which are the biopsy consent and the liquid nitrogen consent. After that, we have the prescriptions, and then we have the photo consent, which we give to patients for all procedures, cosmetic procedures. Then we have medical release form of records. We also have a form for Medicare patients. And then after that, you're gonna go ahead and find all of our consents. So we actually made the medical consents in the blue ink, and we made the cosmetic in a pink, and they're all organized by alphabetical order. Medical first, cosmetic second. After that, we have our lab forms, which we work with LabCorp and Quest Diagnosis. When a patient is getting done, let's say a biopsy, we would pull out the consent, put it on the clipboard, go ahead and grab a pen, and we would hand them, let them know that this is the consent for the treatment, and we would have them put their name, signature, and the date.
It's important when we do biopsy to alert them because we're already in the room where the risks are. So this is where the risks are. So it's important for you to know what the risks are. So here it says the risks include bleeding, infection, scarring, keloid formation. So you don't have to memorize this, but basically you want to make sure that they realize that what they're consenting to, right? Because if they're not educated, it's not really a true consent.
Perfect. And then after that, the doctor will go ahead and sign it and date it, okay? Now,
and we don't scan it in until the doctors have signed off on it and the patient's signature is on it, and then it's ready to be scanned in.
If a patient was doing a cosmetic procedure, let's say they were doing Botox, we would go ahead and go down to the pink, find the neurotoxin consent. We'll go ahead and grab that one, and we would also grab the photo consent. Again, we would go ahead and put them on the clipboard, and you should be aware of the consent where initials and signatures are needed. So our most common one, it's the neurotoxin one. We do need initials here after they read the consent. On the second page, there is a initial at the top, which is very important that we make sure that they initial as the patient before they get the treatment done. Also, name, signature, and date. The consent will go ahead and walk them through what to expect, what they're going to be doing in the procedure. We do also have the photo consent that we give to all cosmetic patients. This is, we do take all their photos for before and afters for procedures, but we do also, if they allow us to use them for social media, website, for Dr. Kormeili, and if also they allow us to record part of those procedures, we need this form. So they would put that they consent. If they are okay with it, but they don't want to show, let's say, their eyes, or they don't want to like show a certain part of their body, we would just go ahead and have them write there what they wouldn't want to, and then they can put they consent. If they're totally not okay with it, then they can put that they don't consent, name, signature, and date.
It's important to tell the patients that they're giving us permission to be able to use the video photography. This release form has no bearing on their treatment. We would treat them anyway, but if they allow us to be able to use it, we appreciate it.
And again, we don't scan them until they've been signed by Dr. Kormeili or Dr. Sand.